I'm James Zanewicz of Connect here at the BLPN during JPM Healthcare Week. Nataraj Pagadala here of LigronBio, right? LigronBio. Sorry, I did it backwards. Anyway, it is so great to have you here. People will remember that now because I screwed up, which is great. It's their favorite part of these interviews. Welcome to the BLPN interviews during JPM Healthcare Week. Beautiful views, great science, great companies. So want to learn a little bit more about you first and your background. Can you tell our BLPN members a little bit about yourself and your journey to get you to your company?
Yeah, thank you. It's glad to meet you, and also it's glad to be part of.
Oh, is it not on?
Oh.
Hello?
No worries. Okay, we'll start over. Yay! They like messing with me. They're terrible. LigronBio, right?
LigronBio.
Ligron, like yes, like Latino. Got it. All right. I'm James Zanewicz of Connect here during BLP. I'm James Zanewicz of Connect here at the BLPN during JPM Healthcare Week, and I'm joined by Oh my God, I cannot remember anything today. I'm good. Just 5 seconds. Oh, it's been a long day. Nataraj Pagadala,
Yeah.
LigronBio. Got it. I'm James Zanewicz of Connect here at the BLPN during JPN Healthcare Week, and I'm joined by Nataraj Pagadala of LigronBio. Pleasure to have you here with us. It's a pleasure to have you in the BLPN. Great views, great science, great community to help each other, which is what the BLPN is all about. But to help our members learn a little bit more about you and how they should make connections, I always love to ask folks to tell us a little bit about your journey, your past, what got you to LigronBio and where you are now.
Yeah, thank you, James. This is Nataraj Pagadala. I'm the founder and CEO of LigronBio. I'm a biochemist, basically,
Right.
and I did my PhD in genetics. My first postdoc was done in Belgium on peptidomimetics, drug discovery.
Yeah.
And after that, I did I was an assistant professor for 1 year in India in one of the university by name 𝗕𝗟𝗣𝗡𝗀 University. Then after that, I shifted to as a postdoc to University of Alberta. For 4 years, I worked on Alzheimer's, Parkinson's, and also other neurodegenerative diseases. After that, I worked as a 4 years as a senior staff scientist with Dr. Houghton, who has got a Nobel Prize in 2020 for medicine and physiology for discovery of hepatitis C virus. Then from there, I worked as 2 years as a principal scientist. Then I switched my base from Canada to US as a senior scientist in Carnegie Mellon University for 1 year. Right. Then last year I was given a ranking by Carnegie Mellon University as one of the top eminent scientists out of 2.5 million scientists worldwide. So I'm standing on the top 12% of the scientists, based on my citation records, based on my publications and everything. Then from Pittsburgh, from Carnegie Mellon University, I shifted to San Diego to one of the company working on cancer, on developing molecular glues on targeted protein degradation, where I got my expertise. Then after 2 years, I started my company, LigronBio, which is exclusively working on developing molecular glues, which is a small molecules. Traditionally, it is all the medicinal chemistry properties are similar to traditional drugs, but it is different modality, which helps in the concept of protein degradation. So exclusively I'm working on Alzheimer's, Parkinson's and ALS. My goal and focus is to reverse Alzheimer's in the advanced patients. So basically the reason why I started with this company and also the vision of developing Alzheimer's is I've seen the people, the Alzheimer's, the pain of the patients, every time dementia patients. So that was the pain that, that hurt me a lot, why this particular devastating diseases is not having any kind of a therapy till now. So because I have lots of expertise during my postdoc studies, so I thought that okay, let's this is a time to start, and this is a time to develop some kind of a therapy as a stepping stone that we can reverse Alzheimer's. and we can help these patients, because the reason, and one more scary part about these devastating diseases is, till now we all thought that Alzheimer's is a elderly disease. At the 65 plus or 75 plus, people used to get an Alzheimer's, right? But according to the statistics right now, day by day, the age factor is going down. And right now, it is standing at a place where actually the younger generation is affected with Alzheimer's.
Yeah, so it's almost affecting more people for longer, right?
Yeah. So by 2060, it is also expected that there will be 140 million deaths of Alzheimer's, and most of them are between, and the diagnosed patients are between ages of 35 plus to 45 plus. So, and also the as of now, the statistics is saying that the children are born with different kinds of dementia. Yeah, more than 1,000 children every year is born with the dementia. So this statistics goes on increasing day by day, but unfortunately the therapies are not coming,
not fast enough, right?
Yeah. Novel therapies are not there till now, which can reverse Alzheimer's, which can cure Alzheimer's. That is the reason why I thought, that I need to do something to this, patients, so we started this one, and right now I'm developing a technology, very novel technology, that can do a combination of a gene therapy and also targeted protein degradation.
Oh, interesting.
So that is a very, very novel technology, and we did a lot of experiments right now, and the experiments are promising, and we are getting very stunning results as of now. So that is the reason why I want to develop this technology as soon as possible, so that we can complete the clinical trials as soon as possible by another 2.5 years to 3 years. Then if that's also promising, then definitely this therapy can come to to the market for these people who are suffering from millions of the people suffering from this dementia.
Well, that's an incredibly interesting thing that you're working on right now through the company. And so the one thing that I do want to ask you next is, the community of the BLPN is all about helping other people, but when you come on camera, when you're going to do this and kind of put yourself out there, you get to ask the BLPN community for help. So what can they do to help you in moving this forward and making this vision a reality and helping patients everywhere?
So actually, I'm glad to be part of a BLPN action, because for the first time BLPN has given me a very great confidence that I can meet with the people who are like-minded, right? So, and also with all the life sciences, basically. Till then I don't know where to go actually. I don't know whom to talk to. But when I saw the BLPN, with all the exclusively life sciences people, then I got a very good confidence that there are some community with my background, who can understand my language. So that's where actually I started with my journey with the bullpen.
Oh,
so now I'm getting actually with through bullpen, I'm getting connected to many other people in the life sciences community, including the investors, including the partnerships. So I'm expanding my network. So now I'm requesting all the investors from the bullpen that because this is a mission-based research. The therapy is not like not for Nataraj, not for company, not for LigronBio. This is for the people who is suffering millions of suffering from the ages, right? There is no therapy. So what I'm saying to all the investors, to come forward, protect the younger generations for future. That is very important. So take this as a priority, as a national priority, because this is a slow pandemic. Now, and this is going to affect more than a COVID-19, which wiped out the entire world, right? But this, in a COVID-19, if you see the survey of a COVID-19, most of the people, in the old age people, in the long-term caregiver, they were, passed away. The statistics are very scary. So that is the reason why we need to take this as a mission-based research. And please come forward and help me out so that I can complete this particular task. for the millions of the people suffering from this.
What kind of round are you raising right now?
Right now, I'm in a pre-seed round. I'm
Okay.
looking for $1.5 million to complete this technology and do the target assessment in the animal models within the next 12 to 18 months of time. So then immediately once we complete the technology, we go for a seed round and raise approximately 15 million to complete preclinical validation and also in animal model studies, IND enabling studies, so that we can step into phase 1 clinical trials in less than 36 months. That way, very soon, I can collaborate with, once this particular phase is passed, then I can start collaborating with big companies like Pfizer or Johnson & Johnson to step in for further clinical trials, complete the task, and let us release this particular drug molecule as a therapy for reversing Alzheimer's. Not only that, Alzheimer's, this technology also works for Parkinson's, ALS, and also all the other neurodegenerative diseases where the amyloid plaques are the biggest problem. So that is the reason why, because all the therapies, if you see around Alzheimer's, all the therapies like traditionally small molecules or monoclonal antibody therapy, everything is not successful. Everything got failed as of now.
Right.
Yeah. So that is the reason why we need to have novel technologies, that can help these particular patients. So my technology, which is called as a 𝗪𝗠𝗀𝗃 technology. So expecting for the movement, I'm expecting that one intravenous injection will be for 4 to 5 months or maybe 6 months, and one one pill, in the oral pill will be for monthly once. So that's what I'm anticipating that. But depending upon the phase 1 clinical trials, this therapy strategy might change.
Yeah.
But,
so if this resonates with somebody and they're interested in talking with you about investing, what is the best way for them to get in touch with you?
Yeah, please contact me through my email, and also through, please check all the details in the website. But my email is 𝗪𝗏𝗃𝗀𝗃@LigronBio.com.
Got it. And we will have that linked in the post for this.
Yes.
The BLPN is very great about that. And when people reach out to you, what is one little fun fact or one little fun word they can throw in there where they watch this and they know about LigronBio?
The fun fact, sorry, I don't know about the fun fact.
Or just be a fun word or whatever. Just something where you kind of know, like, oh, I should read this. They actually paid attention and watched the video.
I don't know. I don't know anything about that.
No. What does Ligron mean? Why did you name it?
So Ligron means basically it's a combination of E3 ligase.
Yep.
Ligase is a term actually. It's a body's natural machinery, and Ligron is a diseased protein motif.
Nice.
It's a combination of natural body's own machinery with a target protein.
So somebody can reference that and that they know how your name came from. And there's your little
that's how the name came from. Yeah.
Awesome. Well, thank you so much for joining us at the BLPN. It's been a pleasure to have you here and learn more about your company. Looking forward to the community reaching out and helping you out and having a great JPM.
Thanks a lot, James. Thanks a lot. Thanks a lot. This is a great interview. Thanks a lot for helping me out. Yeah.
Awesome. Thank you so much.
Thank you.